The plaguing catastrophe of the COVID-19 pandemic has had its bearings and different flashpoints have aroused, reflecting the underlying reality around medical supplies and vaccines. Despite the alarming urgency, the decision to delay the second dose of the Covishield vaccine to 16 weeks has raised castigation across the community. V.K Paul, Chairman, National Expert Group of Vaccine Administration, has suggested that decision-making was not inclined due to the shortage of vaccine jabs, but rather was a scientific explanation of evidence from the United Kingdom. The condescending factor in the whole scenario is that how come the UK health experts have diagnosed the process of extending the Covishield gap when they have now decided to reduce their Widened preface to administer the COVID-19 vaccine from 12 weeks to 8 weeks only. The vaccine stocks have dried up and they have no answers to the surging demand. It might be a paramount reason for such comments, but nevertheless, the strangling will propel our deterioration further. Dr. Paul condemned the agitation of the citizens and claimed that it was sad and false narratives that the interpretation underwent arguments and due to the comprehending stages. The structural discernment in the vaccination process is the viable reason for vaccine shortage, and delaying the second dose by a month or so wouldn't change the complexion, he told the renowned news outlet The Hindu in a telephonic conversation. The Indian scientists weren't able to evaluate the predicament of COVID-19 vaccines during the time of research, as the extensive data did not become available due to narrowed scope. It doesn't take us away from the presumption adroit strategy opted in dealing with such a deadly mutant of the virus. Relying on the UK for real-time data analysis in itself showcases our proficiency to deal with harsh circumstances. Even decades ago, India's healthcare system promised to be a virtue of the world's best facility setup. The top analysts across the world, however, believe that India will be able to enhance the supply of the first dose of Covishield and Covaxin vaccines. But how would they know that India is venting a regional tussle of accusations and blame game to procure more vaccines?